a lot of people have so many side effects from the drug they just want to get to zero. But that's a nightmare. So you talk about safe tapering. What does a safe taper look like, and why does it have to be that way?
Yeah. So a safe taper is a hyperbolic taper, meaning that when we use the word hyperbolic, it just means that the reductions have to be smaller and smaller towards the end. So the closer you get to 0 milligrams, the smaller reductions have to be. And so in the beginning, depending on what your dose is, because they're generally using too high doses in psychiatry, just in a general sense. So that means that there's definitely not, it's not necessary to go, we talk about these 5 to 10% reductions. That's kind of the rule that most people tend to be able to follow, 5 to 10% of your current dose in reduction. But it's not necessarily, it doesn't have to be necessary in the beginning if you take high doses. So there's definitely a place for most people, for bigger reductions in the beginning. You can cut some chunks off, and then at some certain point the reductions have to be smaller, and at some point they have to be much, much smaller, the dose reductions, when you approach the lower doses, because the body can detect smaller changes in dose the less drug there is in the system. It sounds kind of counterintuitive, like the less drug that's in your system in terms of milligram, the more your body reacts to the changes. So, and also a factor is to remember that there are side effects and there are withdrawals, and that's not the same. I hear some people say side effects of coming off, and I understand what they mean, but those are two different things. Side effects are unwanted effects of taking the drug, of having the drug in your system. It's a side effect. And withdrawal effect are unwanted effects of the body adjusting to a lower dose than it has adapted to. So these are two very different concepts. And what ends up happening if you have very severe side effects is you kind of get caught between the side effects of taking the drugs and the withdrawal effects of not taking it. So you're caught between those two. And what we don't want is to become too eager to stop, because the side effects can be so horrible, to then add on top of the side effects horrible withdrawal effects, with the rationale being the faster we come off the drug, the faster I come off the drug, the faster I can avoid these horrible side effects. That's the last thing you want to do. Believe me, I do understand it, and we'll taper the drug as fast as possible, but often fast as possible is slow, going slower. You don't want to add withdrawal effects on top of side effects, believe me. So, but it is tricky, and that's difficult for me it's difficult to put up rules here, how that equation aligns best, like what's the best match or balance between side effects and withdrawal effects. So the main problem is that the doses, the main technical problem of coming off psychiatric drugs, as the field looks now, is that actually the doses you can buy at the pharmacy and get prescribed from your doctor are not made for tapering. The dose in them are too high. So the body can detect changes in dose that are lower than the lowest dose that you can buy. So, and that's kind of it's tricky, it's kind of a trap, right? I don't know if it's intentional made by that, but it is in essence a kind of trap, because you need to go lower than the lowest dose, and that's where all that's where we have to be creative with making smaller doses than available. And that's where the weighing and dissolving it in water and opening the capsules and counting beats come in. So hyperbolic tapering is the one universal rule. And that means that if you've been trying to taper, if you're trying to come off the drug with the standard available doses, even though you use the break line, so you can maybe half the pill and make it into quarters, that's still not a tapering. So the essence is, if you try to come off your psychiatric drug with the available drugs, standard available drugs, and following the doctor's guidelines, and you got bad, like it was an unsuccessful attempt, there's hope. Because that was not a withdrawal attempt, that was not tapering. It was, the resemblance between that and a cold turkey is high. Because the dose you stopped at, even it's half or quarter of the smallest dose, gives rise to huge biological effect in the brain. So if you stop there, that was not a tapering attempt.